All right, so just finished gowning and gloving, and now I'm ready to set up my sterile field. Now, this is what I do. The first thing I do is I separate a few things. This is your drape, these are your towels, your mayo stand, and your surgeon's gown. I'm going to separate. I know my towels are going to go up top here, so I'm going to make sure they do that, and make sure they don't go over your table. I know this is my gown or the surgeon's gown and the drape, so I'm going to put this over here for now, and this is my mayo stand cover. I want to get my mayo stand cover first, and I'm going to try to get my mayo stand set up as quick as possible, because in the case of an emergency, you're going to want to have your mayo stand ready to go. So I've opened up my my mayo stand cover. It says put my hands on the inside. I'm going to do that. If you need to grab the inside of this, the contents of the, you can feel the folds of the rest of the mayo cover inside here. And if you want to grab it to make sure it doesn't come out and fall down, that's great. But then I'm going to create a little mouth here. I'm going to come to my mayo stand, make sure it goes in that mouth, and I'm going to push it forward all the way. And then once it's in there, I'm going to put my foot on the little feet of the mayo stand. And then I'm going to push kind of from the bottom. You don't want to push from the top. You want to kind of push from the bottom and see how it pushes all the way. Now, when it gets to right here, I'm going to extend my hands and just be so and let it fall. Now, from here, you need to make sure that this does not fall below table level. There's a sterile piece right here about this mayo cover, so I can put my body up against it to protect it. And then I'm going to take it right here from the bottom. Here's the side. Go underneath just a little bit, and I'm pushing from the bottom, pushing from the bottom, pushing from the bottom, and it creates that mayo stand right there. All right, now it's covered completely on all sides. I'm going to take 2 towels, going to open them up. Now, we're not going to create air current and do this. All right, so we're just going to open them up nicely. I'm going to place it down, and there is a correct way to orient this. The first one is going to go right here, and I like to tuck my towels. Is it mandatory? No, it's not. But I think it's nicer and it's neater and it's more concise, and it doesn't allow for any potential contamination. See how much excess you have there? So I like to tuck my towels. And take this towel here. See how we open it up all the way? And I'm going to place it down on this side. And if you notice, I left this side right here is that there's an opening. Something's going to go inside underneath here, and you'll see that in just a second. Take this and then tuck it. If I wanted to tuck this side, I could too. But see how nice that is? Leave this here. The next thing I'm going to do is to get my instruments, and I'm going to place them over here. I will, if you can't pick this up in this video, I'm going to show you how to do that at a different time. I've checked the chemical indicator. I see it. You can't look into it like that. We will make sure it's good. They will make sure that the container doesn't have any moisture in there, that the filters are intact and everything is good, because I don't want to have a contaminated tray and then place it on my sterile field, because then I'll contaminate my field. When I'm in here, what I want to do next is I want to make another rolled towel, or make my first rolled towel. All right, and this rolled towel is going to go on the bottom. Now I like to keep my edges and then roll my edges. That way I have, I don't have any. It's only one edge on the outside, not 2. All right, so there's my rolled towel. I'm going to take my stringer. I'm going to orient it this so. Now don't slam it down, because you could create a hole in your back table. All right, all my curves are facing to my left, because right here are where my sharps are going to be. So I'll leave that there just like this, and I'll start getting things out of my instrument tray and start putting them where I know they're going to be. All the retractors need to go up top, up here, top right. I know my goulet goes on my mayo stand, so I can go ahead and put it there because I've already draped my mayo. This is the balfour, and there's the blade to the balfour, putting all the retractors up top. Okay, a malleable. All right, I know my hemoclip pliers go down here to the right, so as I'm pulling things out, I'm putting them where they go. Wheat lanterns go here, Army Navy is another retractor. I need 2 forceps on my mayo stand, one toothed and then one smooth, so I'll do that. The other forceps I have we'll place right here in the middle. Now I'll leave one side for toothed and one side for smooth. That way I know which one's which. You have a 2-piece pool. You need to make sure that wasn't together in your tray. If it comes in, if it's together in your tray, it was contaminated. So we attach that and we can place it down here, because once we open up the peritoneum, we will switch out the Yankauer suction tip for the pool abdominal suction. I've got another Adson. I got my knife handles. I'll put those to there. Another hemoclip applier. I've got another Adson. And then I've got my, all right, so everything in here is done. I want to hand this off because it's just going to get in my way. Now, when you do that, you can't turn your back to hand it off, all right? So I'll step back, and we want the farthest distance away, farthest distance away. That way we don't have any accidental contamination. Now, I can plate this back over here. We're looking good. I forgot to put my stringer back in there, but that's not an issue. I take these off, and make sure you do it nicely. That way nothing gets unraveled there. I can take this back and give that to the circulator. All right, so I've got I got scissors up here. Well, I know I'm going to use 3 scissors for my mayo stand, so I can go ahead and put those up. When you're doing this, you want to make sure that all the curves are facing down or curves are facing up. That's going to go Metzenbaum, straight mayos, and then curved mayos. I like my points down. That's just what I like. We need to make another roll towel over here. So you can see this one was the hot dog. This one is going to be, well, a hot dog as well. Then we fold it in half. All right. And then we make another towel or another roll. All right. And we're going to place it over here. On your mayo stand, you will have 6 curved hemostats. 1, 2, 3, 4, 5, 6. You need to make sure they are all closed. So I closed them all at once. And I made sure. And you're going to have the curves facing towards your sharps. Just like here, you have your curves facing towards your sharps. On your mayo stand, you'll have them facing towards your sharps. And your sharps are going to be on the right side of the mayo. So it's opposite from the back table. So we have 6 straight hemostats. Then we're going to go to 4, or we have 6 curved hemostats. Now we have 4 straight hemostats. All together at the same time, I closed them. And then we're going to place them up there, followed by 4 Kellys. 1, 2, 3, and 4. Curves going towards the sharps. All right, and then to consolidate this a little bit better so it's not so crazy, you can just push things together. That'll be fine. It looks nice. This is good right here. If you've noticed that we put things in pairs on this mayo stand, okay? We put things in pairs. We always want to work in pairs. I'm going to take this towel, turn it upside down because this is a place for my probangs. I'm going to place those there. I'm going to start getting things out of here. So here are my Ratex. I meant to swap out these Ratex for those laps. All right. This is my, it holds the knives. We need to make one more towel for the needle counter. So we come long ways again. Fold it in half. Long ways, and then from here we take it like so, fold it back, maybe a little bit more here, and then fold it back again. Now this is our suture book, okay? So we put it right here, right in the bottom corner. Make sure nothing goes below table level. This is our needle counter, and we put that right here. There won't be knife blades in here. You'll have to open them up. They'll either be sterile inside of your pack or someone will have to open them up to you. I'm just now getting things out of here so we can start start the rest of the process. All right, got my basins for a septo. I know this is going to go in here. These are my other laps. All right. Will you hand me the 2 laps and the Ratex, please? These are my they're in there. Bottom cabinet, second one. This is a 2-0, 3-0, and a 4-0. Now, the way I remember this is the 4-0, we have a number 4 knife handle. So the 4-0 is going to go underneath the knife handles. 4-0, the number 4 handle. When you're really doing it for surgery, you will open this up and then throw away and have these strings hanging down. But for checkoff purposes and practice purposes, we're just going to stick them underneath here. 4-0, 3-0, and 2-0. And we're going to stick them underneath this towel. That's the reason why we had that first towel go a certain way, the second towel go this way. That leaves the opening up here for our silk strands. All right. This piece of paper here is a wrap, so we're going to take that and I'm going to make a little trash can right there, and I'm going to put it to the side. Sometimes people just leave them here until you know you've counted. Until you know you've counted. Oh, I needed that one. Yeah, it fell out. I needed that one. Don't do that. So some people, they keep that paper on to indicate I haven't counted yet, because once you count, you'll separate these each by one. All right, any suture that you have opened will go into the suture book. Well, that's nice. That makes sense. So any suture that you have, we're not worried about orientation, which suture goes where, but it would be nice to keep all the similar ones together. That would be smart. Maybe you're absorbable on top and you're non-absorbable in bottom. However you'd like to do it, that would be up to you once you graduate. All right. That's a scratch pad. This is my reel. I know it goes up there. We're going to get rid of all of our trash. I've got a ruler. I've got a pen. Here are my peanuts. In the real world, we would peel this off and place it down, but for practice and things like that, we're not. And here's my Yankauer suction tip. You can go ahead and get rid of all trash. We want to take care of any trash that we possibly can prior to surgery starting. We don't want the doctor or the patient having to wait. So I make sure that's good and secure. Now, at this point in time, you got to make sure that it doesn't fall down below table level. If it does, it's contaminated. Okay, so everything is out. We've emptied our bucket. Everything is out. I am now ready to count. Okay, ideally, you want to count when everything is on your back table, but sometimes that's just not possible. So I went ahead and started setting up things over here. But you would count when you have all your soft goods out and all the instruments out. And then you and the circulator, we'll show you how to do that as we progress through the program. So 1, 2, 3, 4, 5. All right, that one just fell. Is it contaminated? The answer is no. Yes, it did extend beyond the table, but if you've taken geometry, this is a plane, all right? So everything that's table level, that plane extends infinitely, all right? Well, really maybe a foot. So it extends beyond this table. So anything that's straight out like this would be okay. It's not considered contaminated. It's not considered contaminated. However, if it's out and then falls down below table level, that's what makes it contaminated. So if this falls down like here, it's not contaminated, but if it would turn just a little bit, then it would be. All right? And if you ever have a doubt about the sterility of an item, always remember, when in doubt, throw it out. So this is a little bit messed up. It wouldn't be like this coming out brand new. You should have a new one, but if not, hey, it's a simple fix. Just make sure that when you're setting this up for the next person, it's nice and neat. Okay? Be kind to your classmates. Make sure things aren't falling below table level. Man, this really got messed up. All right, this goes in your magnetic pad along with the bovie. All right, so to do the bovie, you need to make sure that it's an arm's length away. You want to keep it like that, and it's like an arm's length away. Okay. I'm going to walk this back down through. We're going to stick the end of this in the rigid holster. Okay, and maybe I'll just do one more just for good measure. All right, one more loop. All right, the rest of it can remain on the outside. This is our scratch pad. We're going to peel it back just a little bit and place it here so it sticks. All right, leave that there as so. We are going to place our suction on top and our suction tip. We are going to attach an Alice. Oops. Nope. A towel clip to the outside there. We're going to open up just like so with our laps. And then we're going to close this up. This is what I call the burrito. Put all the stuff on the inside, and then we're going to close it with an Alice. The Alice is what's going to keep it attached to the drape. All right, so we're going to leave it just like that. I'm going to set it over here for the time being because we're going to use that in a little bit. All right, so now I'm going to finish setting up my mayo. I've got my knife handles here, my knife blades inside. What do we use to put on knife handles or knife blades? Use a needle holder. Okay, make sure you grab the spine of it, place it on, and I'm going to set it on my towel. I don't want to accidentally put a hole in my drape. Ooh. All right. Instruments that are on your back table should remain open and unratcheted. Instruments on your mayo stand should be ratcheted. Now it goes for the number 20 blade. That's the one we're going to use first on the outside. Then we'll go to the inside knife, which is your 3 handle on it with a 10 blade, and then a 7 handle with a 15. Now you want to orient this to where if the patient were to put their right hand and lift it up and straight and touch your mayo stand, they would touch the knife blades. So that's the way you want it oriented. This mayo stand is going to come in straight over the patient just as so. And so if the patient lifts their right hand and places it on the mayo stand, they will touch your knife blades. So I have my knife blades and handles. I've got my retractors and my forceps. I've got my scissors. Am I missing anything here? I don't believe so. I've got my ties. Everything is ratcheted. If I want to check one more time, I can take some kind of forcep and just double check. Everything seems to be good. I need to cover this with 2 towels. All right, this is going to be covered do the first one here like so. All right, and there's a reason why I'm doing this one first. And then we'll do the second one out back like this. And these can hang off. These can hang off. Once we put those 2 towels are for above and below the incision site. Make sure these are all clamped. We're going to place them down here in pairs. And the reason why I put that first towel the way I did is because we're putting 4 more towels on top. And if I accidentally put 4 towels on top of this towel, and if it was the other way around, there would really be 5 towels on top. And we might accidentally grab that towel and knock these over. If you don't understand, just ask me and I'll explain it a little further. But we need 4 more towels, 1, 2, 3, and 4. And we're going to open them up and place them right on top. And these towels are to square off the incision site. We're going to square off the incision site. That's all you need to know for now. We'll work on more on that in the spring semester. All right, so these 4 towels are here. I'm going to put my drape, or I'll put my burrito down first, because my drape goes first. So when we drape the patient out, we're going to drape with 4 towels. We're going to put those towel clips on the 4 corners of the incision site. Then we're going to drape the patient. Then we're going to put the burrito down, start throwing all these cords off. Once we're draped, we're going to put that towel, the two blue towels, one above and one below, and then we're ready really to begin surgery at that point in time. All right, this is all my trash that I have left over. I forgot to do my Ratex, so I'll do that now. And just to make sure, we have 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. So we have 10. Why did I put those out like that? Well, we've got to make a sponge stick or a prep stick to make sure, remember, it's tri-fold, and that blue has to be showing. And we need to have it a little bit farther down. It's like a paintbrush, okay? And then again, here, make sure the blue is showing, and this goes to the side. All right, this is my trash. Okay, see how I stepped back and then I turned. We say don't put your back towards a sterile field, but once we're far enough away, this would be okay. This is my prep pot. In real world, I would dump that in there and discard this, but do that so we can symbolize that it's a prep pot, and that we know it's a prep pot. What are these other ones for? Well, these are for pro bangs, and we put those on these as well. Triangle fold comes down here. Now be careful when you're doing this. Don't go down below table level with your fingers. I'm going to move this out the way just so you can see. Okay. When you're doing this, make sure you're not going below table level with your fingers. Okay. And then we'll do one more. Oh, Mr. Derek, why do we have to make these when we already have pro bangs? Well, what if you use all of those and the doctor needs one more? Are you going to open up a brand new pack and waste 4, or are you just going to make one? All right, so there's those. Peanuts. See, everything's in pairs. Like so. And then I'm ready to gown and glove the surgeon. I'm all set up. I'm just waiting to begin surgery.